Today we will discuss the different types of implant abutments. So this is sometimes very overwhelming for the implantologist to know about the abutments and their uses. So as we know that abutment is a component of the implant on which the crown or processes will be made, right? So first is a stock abutment. Stock abutment, which is provided by the manufacturer, can be hex and non-hex. Here we need to understand what these terms mean. Hex means that abutment will have this polygonal shape, right? Like here, the abutment will have this polygonal shape, and this will sit on in the implant and it will lock itself, so it will reduce the micro movement and it will have a precise fit. Whereas in case of non-hex abutment, you will see it will have a circular cross section like this. So it will not have a it will not lock itself, it will not have a precise fit, but again it has its exclusive use in some condition we will discuss later. So in stock abutments can be hex and non-hex as we discussed. It can be straight, or it can be angled. So different manufacturers have different angled stock abutment like 15-degree, 25-degree and others. Right here it is a 25-degree stock abutment. In non-hex abutment also you will get angled abutment and straight abutment. So this is all about the stock abutment. Now let's talk about a different kind of abutment called castable abutment. Castable abutment or UCLA. You see, this is a castable abutment. Here you will have a plastic sleeve on the metal structure. So this metal structure will fit, it will have a precise fit in the implant, and this plastic sleeve will be used for casting the crown or prosthesis over it, right? So castable or UCLA abutment can be hex, again if it has those polygonal shape at the bottom, or it can be non-hex, right? Similarly, the third very important kind of abutment is tie base. The tie base abutment can be hex and non-hex, again can be angled and straight. You see, tie base abutment has got a titanium connector, and on top of it you will have a very customized crown or exclusively the ceramics or zirconia, and this tie base abutment will have a very good biomechanical strength and aesthetics, right? And it will also facilitate the digital workflow like the CAD/CAM workflow, and it will help in making a very precise and customized crown, as well as the gingival fit or emergence will also be very nice. That will promote the tissue health. So this is an excellent method to go for a screw retained zirconia or ceramic crown. Let's talk about another type of abutment, which is called pre-milled abutment. You see, pre-milled abutment will have this big metal blank, and as per the patient's requirement or the patient case, I would say, these abutment will be shaped, for the crown or for the prosthesis, right? So it will have a very accurate customization as far as looking at or considering the patient crown, right? And it will also facilitate the digital workflow, like the CAD/CAM workflow, and the tissue emergence. It will be very beautiful with the pre-milled abutment, and so will be the aesthetics. So these tie bases and pre-milled abutment can be again hex and non-hex, and they also come in as straight or different kind of angled abutment. Right, now let's talk about a multi-unit abutment. So for arch restoration or a full mouth restoration, you have this multi-unit abutment. You see, the best part of multi-unit abutment is the prosthesis will be made over this multi-unit abutment, and it will be supra-gingival. So you need not replace or change these abutments again and again. What we normally